Hello, everybody. This is Gary. Today is November 28th, Monday, 2022. It is 9:55 a.m. Eastern Standard Time in Rochester, New York. And this is my coping with schizophrenia blog entry for today. Today, I'm not doing well. I've been up since 3 a.m. Didn't get in much sleep last night. I went out for a walk, did my physical therapy exercises. I just did some work on my computer. I just thought I'd check in real quick with this video. My anxiety levels are very high. My agitation is very high. Um, my auditory hallucinations are not that bad today. My paranoia and delusions are pretty strong. I was in the laundry room yesterday and some guy was just kept staring at me. And it made me more paranoid and it made me more agitated, more delusional. I think people are following me, spying on me, laughing at me, trying to intimidate me, plot against me. Um, I'm just trying to cope as best as I can by keeping to my daily schedule. Day after tomorrow, I have an appointment with my peer support specialist. That's a person who has a mental health diagnosis, who works as a counselor on staff to work with patients. I have an appointment with my therapist on the 7th of December, and an appointment, I believe, with my psychiatrist on the 8th of December. I have a telephone visit appointment with my gastroenterologist on December 5th. I had called my gastroenterologist last week because I had some bleeding and still do after bowel movements, but it's a very small amount of blood and it's bright red, so it's probably just hemorrhoids. Um, and my gastroenterologist suggested that I reduce the amount of laxatives that I'm using. I take laxatives because my psychiatric meds cause constipation. It's always a balancing act because if I get constipation too much, I could end up in the emergency room if I don't have a bowel movement for 4 or 5 days. It gets really intense and painful, so I'm always trying to balance those two things out. My psychiatric meds and constipation and having too frequent loose watery stools. It's always bouncing back and forth between the two. My gastroenterologist just suggested that I take in more fiber to give more bulk to my stools, which I'm trying to do. Um, I'm not suicidal. I'm not violent in any way. I'm just checking in. Winter is always a difficult time for me. It's hard to cope. I get less sleep. Um, I get more depressed. I get more anxious. I get more paranoid. I get more delusional. My auditory hallucinations increase during the winter. For now, I'm seeing my therapist once every 2 weeks, when normally I would see her once every 3 to 4 weeks. Um, but right now, I need the extra support from her. Um, I'm just doing the best I can to cope. And there's not much else to report on. It's very windy and cold outside today in Rochester, New York. I just went for my daily walk and just got back. It's very windy out, very wet out. It must have rained last night. It wasn't raining or snowing when I went out this morning, but it is wet and cold outside. And like I said, that always agitates me. I don't like winter. I don't like the weather. It just aggravates my psychiatric symptoms a lot. And I'm just trying to cope the best I can. That's all for now.